This is the January 14th, 2026 edition of the quarterly reporting webinar for temporary healthcare services agencies. We are coming to you from the New York State Department of Health in the capital city of New York, Albany, where it is 1 p.m. local time. So today, we're going to talk about the quarterly reporting requirements, and a little bit of our background real quick is that we are in the Department of Health, the Temporary Healthcare Service Agency team. We are located in the Office of Healthcare Workforce Innovation. Dr. Carrie Rosamilia is our office director, and I'm your host, Peter Landy, the Temporary Healthcare Service Agency Program Manager. Our webinar today will present a statute overview. It will review the components of the quarterly reporting package, and it will review some tricky examples to help you with reporting. The largest portion of our webinar will focus on the requirements of quarterly reporting package. If you have questions along the way, you may want to hold them in the event that they're answered during the duration of the webinar, or you may place the questions into the chat window where members of my team will respond. Our aim is to address as many questions as we can during the time allotted. However, if we run short of time or a particular question needs more research, the team may ask you to send your question directly to our office's shared email box. That email address will be shared with you multiple times later in this webinar. So let's get started. In 2023, Article 29K was added to New York State's public health law, requiring temporary healthcare service agencies and healthcare technology platforms to register with the Department of Health. As a result of that statute, the department developed a website to share all program information. Now I'm going to break away from this PowerPoint for a moment and show you the website. I'll explain a little bit about how it's organized. And you don't have to digest all the website information at this time, but rather know it exists and it's available for you to use as a resource. So this is our website, and that URL will be given to you multiple times throughout the webinar and also in the chat window. At the top of our webpage is this overview, the stuff we're talking about right now. If you had questions about the statute, well, here's a link to the statute right at the top. If you wanted to review our frequently asked questions, we put that right at the top of the page, and our email box is right here at the top of the page. Now, as I scroll down a little bit, you'll see a section right here about registration, and then beneath that is a section of quarterly reporting. This is the stuff we'll go over today. And again, know this exists, that there are instructions for how to use IBM SendVault. And importantly, there is a list of all staffing agencies, all registered staffing agencies. So you can go to this list. I'll click on it and show you. There's hundreds of agencies listed, and you can find yourself. But again, a good resource, know it is available. And then here's a section at the bottom of our webpage on trainings. This session is being recorded and will be posted right here next week. And then at the bottom, there's some reports for the interested reader. And again, our email address is at the bottom of the page. So our email is at the top and the bottom of this web page. So now let's go back to the webinar. So we said that the Article 29K was added, and it requires temp health care service agencies to register with the department. Well, what is a temporary healthcare service agency? Okay, as seen on the screen, it is any business that provides or procures healthcare workers to New York State healthcare entities. And throughout this webinar, I will use the word agency to represent temporary healthcare services agencies and healthcare technology platforms. And I will use the word entities to represent New York State healthcare entities. So, in general, agencies provide or procure healthcare workers to entities. Agencies provide healthcare workers to entities. Well, what is a healthcare worker? If you said, Peter, what is that? Well, healthcare workers are defined in the statute as nurses, certified nurse aides, and licensed or unlicensed direct care staff. So here's your first pro tip of the day. I'll give you a few of these as we go through the webinar. But when reporting on your temporary placements, you will not report people who do not provide direct patient care, such as do not report on a clinical lab scientist, do not report on a medical coder, do not report on a nurse who is only working on, say, insurance billing. The statute again says healthcare workers are defined as those providing direct patient care. So I said that if you are a temporary healthcare service agency, you are required to register. Well, what does registration mean? Registration means you need to do an annual registration application every August, and you must then complete a quarterly report package every 3 months. If you ask, well, what is the registration about? Well, we're not going to cover that in today's webinar. I just wanted to let you know it's on our website and you can look at how to do that. And typically that's in the summer of each year. But part 2 of registration means to remain registered, agencies must submit a quarterly reporting package every 90 days. And those agencies are given 2 months to submit that report package after the end of the quarter. So here is a schedule showing the quarters of the year. We will be reporting for this period, October 1st to December 31, 2025, and that is the current report package due by February 28th. Package will be sent, all those packages will be sent to us using that IBM application called SendVault, but the SendVault overview and instructions are on our webpage. So now, what is the quarterly reporting package? Well, it contains 5 separate items, a quarterly report Excel file, and then Appendix 6, 7, and 8, and a compendium of PDF copies of your invoices. Today's webinar will focus on completion of number 1, the quarterly reporting Excel file. Now, pro tip for you, when getting ready to prepare that quarterly reporting Excel file, download the template from our webpage each quarter to ensure you have the latest version. So you might be tempted to say, I still have it from 3 months ago. I would advise that you should download the latest version from our website. Second pro tip, remember to clear your browser's cache before downloading. So if you did download it 3 months ago, it's possible that the memory of your browser would just return the same antiquated file rather than the most latest file. So download the Excel file every quarter and delete your browser's cache before doing the downloading. So I've done a little picture of the download, and here's what the reporting file looks like. The Excel file will collect information about your agency and also about the healthcare workers you placed. The Excel file has 5 tabs that require your data entry. You'll also find additional tabs for instructions in the workbook. But 5 and only 5 require your data entry. They're shown on the screen. The first tab will collect information about your agency, hence its name, Agency Info. The remaining 4 tabs collect information about the workers you placed during the quarter. Today, we'll spend most of the time on tab 1 of this Excel file, wages and billing, because it typically requires the most effort to complete and usually generates the most questions. But let's review the tabs in order, starting with the agency info tab. Here is the agency info tab from the Excel file. The introductory tab lets us know who you are. It collects characteristics about your business, the Temporary Health Care Services Agency. For the first question on this tab, simply type your agency name in the blank cell below the first question. So there is a blank cell below each question, and that will house your response. The next question 2 says select the reporting quarter. For this current reporting, you will select Q4. It is a drop-down menu. For question 3, we ask for your agency's TAID that you were assigned when you registered. If you do not know your TAID, recall I just showed you that our webpage has a list of all registered agencies and their associated identification numbers. So you can use that as a resource to find your TAID. Then enter the name of the contact person at your agency responsible for the report's information. Also enter their email and telephone number to be used in the event that clarifications are needed. The final 2 questions are just yes/no questions. Question 7 asks whether your agency is a vendor management system, and you'll respond yes/no using the pull-down menu. And question 8 asks whether you placed at least one healthcare worker during the quarter. Why is that important? Well, if you did not place any healthcare workers during the quarter, you will respond no and do not complete anything else in the workbook. In essence, your job is done with this workbook. You will close and save the workbook and send it to us because you'll still have to report. You'll have to report that you had no placements during the quarter. So you'll close and save the workbook. You'll send it to us, and also remember to complete and submit the other components of the quarterly reporting package. Remember, I said there were 5 components. I believe the only one that's important if you had no placements would be this Excel file and the Appendix 8 attestation. So after the introductory tab, which collected info about your agency, we arrive at tab 1, wages and billing. It is now going to collect 7 columns of information about the healthcare workers. When completing the information, please remember to use the drop-down boxes where they're provided. And you see I have it circled right there that you can see the columns that have drop-down boxes. Note that tab 1, wages and billing, must identify all the amounts that were paid to the workers. So any amount paid to the worker has to be identified on this tab of the workbook. Now let's look at the 7 individual columns A through G, and I'll give you some more tips on how to complete this efficiently. So in column A, you need to provide or select the name of the entity where the worker was placed during the quarter. Pro tip, if the worker was placed at more than one entity during the quarter, please identify all entities where the worker worked. So if myself, Peter Landy, was a registered nurse placed and I did 1 month at one hospital and 2 months at another hospital during the quarter, you would identify both of those healthcare entities. Use the drop-down box to select the correct entity name, and note that that drop-down list contains over 5,000 choices. So that's a little unwieldy. So here's another pro tip. To narrow the number of entities in that list, in that drop-down list, simply enter a few letters of the entity name in the drop-down box. In my example on the screen, I entered the word High Peaks, and the list of choices reduced from over 5,000 to just the 2 entries that contain the sequence High Peaks. Another pro tip, if you are going to enter multiple rows for high peaks, you don't have to keep doing the search on every row. You can simply copy and paste row 2 to row 3, row 4, etc. So after you select the entity name in column A, you'll move on to column B, and you'll see there's a list of job categories. Select the job category that's most appropriate for the particular worker that you are reporting. You may select Other at the bottom of the list if the specific job category or a similar job category does not appear on the list. In my example shown, I created a little example here where I placed workers at our local Albany Medical Center in 2 different job categories, and you see how that would be reported. The first line is registered nurses, and the second is that I placed licensed practical nurses. Then in column C, the third column, you will enter the total number of workers during the quarter that were placed at the entity and job category that you just identified in the previous columns. In my example, it shows that I placed 4 RNs and 7 LPNs at Albany Med Center. Column D then shows the list of payment types and benefits. Recall, I said you need to identify all amounts paid to the workers. So you'll need to create a row for each pay type the worker received. Pro tip, to help categorize each amount that you paid to the worker, you may need to use an other category, and I suggest you use other fringe benefits at the bottom. When I developed the workbook, I made a mistake. I don't have just a general other. So please use other fringe benefits when you mean other. Consider, we've gotten questions about allowances that you paid for uniforms or for dry cleaning or for training sessions, right? Those don't fit neatly into the pay type or benefit categories shown on the screen. So in my example, I had all 4 RNs receiving regular pay and overtime. So I created 2 rows, right? I previously had, I had 2 rows and I created 4 rows. 2 for the registered nurse because they received regular pay and overtime pay. And then all 7 LPNs received regular pay and lodging and meal stipends. Notice in that drop down for pay type or benefit that the first few pay types are considered hourly pay types, and the latter pay types are not necessarily hourly. This is important when we complete the next column. Let's take a look. Column E asks for the total hours, and you should enter the total hours for all workers in the pay type selected. Remember, when you enter regular pay, it must be less than or equal to 40 hours per week per worker. So it shouldn't be more than 40 hours times 13 weeks times the number of workers. So in column E, you'll continue entering the total number of hours worked by all workers for the selected values of entity in column A, job category in B, and pay type that you selected in column D. You may enter 0 for the pay types that are not calculated by the hour. And you'll see that in my final row. Lodging and meals, 0. Remember, I said that is not an hourly type of pay. This column, hours, is the only field that can have a 0 in it. That's important. So when the pay type or benefit is not one of these, let's take a look, not one of these hourly types at the top, but it's one of the bottom ones, then that is the only time that you can enter a 0 in this whole spreadsheet. That will save some back and forth. Sometimes people submit incomplete information on their quarterly report, and my team will circle back to you to get clarification. So as long as we understand up front that there shouldn't be zeros or missing data, then that should expedite the process. Now in column F, you just completed E, the total hours, and now F, you'll enter the total amount of pay the workers received for the hours you just reported. Report the total pay amount or the benefit amount using an accrual accounting method, which means you should report the amount earned by the worker regardless of whether the worker actually received the pay during the quarter. So think about you pay your staff on a lag. They worked 40 hours during the quarter and they don't get their pay until next quarter. You would still report that they earned the 40 hours of work and the amount of pay during the quarter. So think of the accrued pay as you are reporting the expected amount to be paid to the worker. Enter your amounts to the nearest whole dollar. Please do not use commas, periods, or dollar signs, but note the column will automatically format like I show on the screen using a decimal point. So that is the total worker pay. Now we're going to move on to column G, the total billed to the healthcare entity. This is the final, the right-hand most column of the 7 columns about workers on wages and benefits tab. So the total billed to the healthcare entity in column G, you will enter the total amount billed or expected to be billed using an accrued amount expected to be billed to the healthcare entity for the job category, pay type, and total hours reported. If again you used total hours of 0 due to the pay type, lodging and meals, then enter the total amount billed to the healthcare entity for the worker's pay type in column D. So in my example, let's look at row 5, where it says licensed practical nurse, lodging and meals, 0 hours. The workers received, each of the 7 received $5,000 stipend for the quarter. The total was $35,000 paid, and it was marked up, let's pretend, and it was billed $52,500 to the healthcare entity. That's how you should report on tab 1, wages and benefits. Now, that's all for tab 1, which sounds pretty quick, right? But I want to go over some practical examples that will help and give you the correct guidance, because we do receive handfuls of questions about this. And one of these practical examples I'm going to call the all-inclusive rate. Some agencies have sent us reports like the one I'm showing on the screen, and it has 0 amount billed to the healthcare entity. But I mentioned a moment ago that there can be no zeros or blanks on this worksheet. So the team, upon audit, this didn't meet the requirements of the statute, and my team inquired about the 0 amount billed, and the agency has told us that they bill an all-inclusive rate, and that the amount billed for the all-inclusive rate falls under regular pay. So we don't have a specific billed amount for overtime or lodging and meals. And that's how they reported the information to us. Regrettably, that report does not meet the statute's requirements. Rather, the statute prescribes that agencies identify the amounts paid to the workers and the amounts billed to the entities using the category of pay type or benefit. So it has to be partitioned into these pay types by statute. If an agency elects to continue to bill an all-inclusive rate, then it is expected the agency will do the necessary accounting to identify the amount billed to the entity. And they're going to identify the amount billed to the entity to cover the expenditure of the worker pay. In other words, the amount billed must be greater than or equal to the amount paid to the worker. Take a quick notice of the amount billed in column G, 20,000 and 50,000. Here is one acceptable way that the information could have been reported. In this example, it's just an example, the agency identified the amount of billing needed to cover the worker expenditure in column F. So in column G, they identify the amount of billing that's needed to cover the expense in column F. In this one, they still have $20,000 for the first two records, right? It's partitioned and it shows no markup in the overtime pay. And then the LPNs still billed 50,000 total, but the accounting was done at the agency to partition the 50,000 into regular pay and lodging and meals. That's one acceptable way to report. Here's another acceptable way to report shown on the screen. In this case, the difference is this fictional agency reported a markup on overtime pay and a markup on lodging and meals. The first two records still total $20,000, right? If I back up, it was $20,000 for the first registered nurse pay. So it's just partitioned. You've done the accounting to show how each of the pay type or benefit in column D was billed to the healthcare entity. So that's one practical example that we receive a handful of questions on, the all-inclusive rate. I'm going to move to a second practical example that can give you some guidance. And I call it the we don't know example. And in this case, the agency failed to identify any of the amounts billed to the healthcare entity. When my team contacted the agency to ask about this, the agency responded, "We don't know how much was billed because we placed our workers through a third-party agency." The "we don't know" report can also look like this. Right? Here's the two different ones. They can say, "We don't know what was billed," or "We don't know what was paid to the worker." In this case, the agency said, "We don't know what was paid to the worker because we subcontracted the work to another agency." Both of these reports do not meet the statute's reporting requirements. Both of these reports, these failing reports, appear to stem from relationships like the one that I've drawn on the screen, where agency one places workers at a hospital, the letter H, hospital, places workers at a hospital through the use of agency two. When this situation arises, it's incumbent on the two agencies to gather the required information, ostensibly from one another, and place the required information into the quarterly report. The agencies can include this information sharing requirement as part of their contract between the two agencies. Note, of course, that reporting issues like this may stem from relationships involving more than two agencies, but the agencies will still be subject to the same statutory requirements of gathering the information and completing all the fields on tab 1 of the report. So those were the two examples that I think are probably the most burdensome, and I wanted to identify them and provide that guidance. That's all we have for tab 1, wages and billing. We'll now move on to the final three much shorter and much faster tabs of the Excel workbook. This is an opportune time just for me to take a breath and ask my team to share the temp staffing webpage URL in the chat window. If they haven't done that up until now, it's probably a great time for the team to send you that URL to our website so that you can access all the information that you're being presented here. The URL will also display on the screen at the end of this webinar if anyone wants to copy it down. So don't fret, we'll make sure you get our website. So now we're going to move on to the final 3 tabs, data entry tabs in the Excel workbook. Tab 2 is called Revenue and Expenses. On this tab, you will enter your agency's revenue and expenses incurred from sending temporary healthcare workers to entities. The amounts billed to entities are what is called your agency revenue. I'm going to repeat. The amount billed to entities at the top of the screen is what is your agency revenue, the amounts you bill to the entities. All amounts billed to entities must be identified in the total agency revenue section on this tab. All amounts billed to entities must be identified on the total agency revenue section at the top of this tab. So you need to identify all amounts billed. Recall, tab 1 asks you to identify all amounts paid to the worker. Tab 2 asks you to identify all amounts billed to the entities. And you can consider, well, why would something appear only on tab 2? So the amounts billed to the entity might not necessarily be paid to the worker. The amounts you bill to the entity could be for record keeping or contract administration or for overhead expenses like rent, utilities, supplies, insurance. You could even bill for salaries and benefits of the administrative staff at your agency, right? Those would be amounts you identify on here, tab 2, because they would not appear as paid to the worker. Please note that the total expense at the bottom should be less than the total revenue at the top. Right? That would make sense. Businesses are in business to make money. So your expenses should be, the bottom yellow bar should be less than your revenue. Now, notice if you don't like if you don't like the categories that we placed on here as just samples, there's additional space to provide your own category of revenue. And you can add lines. If you say, Peter, I need more than 2 lines, you can add lines to this and you can insert 5 lines. Okay. Down below, there are also areas where you can add your additional categories of expense if you don't like the ones that we have provided. Notice that your total expense should identify the wages and benefits paid to the workers in the first line. So I have it circled on your screen. Your first expense, and probably your largest expense, is the wages and benefits paid to the healthcare workers. This should be the same total as what you put on tab 1. I hope that makes sense. That's all we have for tab 2. Tab 3, the U.S. location tab, you will report the state and zip code of the worker's primary residence. So this tab, which is called U.S. location, is only for workers whose primary residence is in the United States. Now, as an example, if a worker from Florida took a 1-year assignment in Albany, New York, and that worker obtained an apartment for a year in Albany, New York, then their primary residence should be reported as Florida, not New York. You report their primary residence. And you can do it. These all have pull-down menus. So the states have, column A has a pull-down menu, and column B, the zip code does not. But then you report their Column C, primary work location, the county in New York State. And then column D asks for the job category. It's a pull-down menu that's analogous to tab 1, the same job categories I showed you on tab 1. So pro tip, another pro tip, you need to include one record for each worker placed during the quarter. So tab 1 allows you to summarize, hey, I had 4 RNs and 7 LPNs. If that were true, you would now say you placed 11 workers during the quarter, and you'd have to have 11 rows of information on this tab, one for each worker that was placed. Now, if a worker worked at more than one location during the quarter, please report only once for that worker and give their primary work location. Peter worked 2 months at hospital number 1, and he worked 1 month at hospital number 2. You would say Peter's primary work location was hospital number 1. So that's it for tab 3 to show where U.S. residents were placed. And tab 4 is an analog for international workers. And you will only complete this tab if you placed international workers during the quarter. The difference is column A has a pull down for the home country of the worker. Again, the primary work location should be reported, and it will be the location where the worker spent most of their time during the quarter if they worked at different healthcare entities. Again, the last column, C, is the job categories that stay the same from prior tabs. So that's really all we have to filling out the Excel file for quarterly reporting. We're going to keep open and stay live here with the chat window to answer your questions. And while those questions come in, my staff can also give you our URL, our website address, so that you have all the information you need for self-help, including our email address. Our email address is on our website. So just write down our website. Now, the quarterly reporting package requirements I mentioned earlier had 5 components. We spoke mostly today about the first one, the Excel file. If you have questions about the remaining 4 components of the quarterly report package, you can ask them now, or you can just take our URL and then send your questions to our team mailbox. I think they're pretty explanatory. Appendix 6 is a more detailed, it's a more detailed report of your administrative charges to the healthcare entity. Appendix 7 is just an itemized list of all your invoices during the quarter, which will be supplemented by the 5th item on here, which is all the invoices, copies of the invoices in PDF format. And then the 4th line here says Appendix 8, you need to sign an attestation that the information provided is true to the best of your knowledge. Here is our email address. I would again say you do not have to write this long thing down, because I would advise that you just write down our webpage. Department of Health webpage will have the email address posted on it at the top and the bottom of the page. This recorded webinar will also appear on the bottom of this webpage in about a week. You can show it to your friends. You can have them over Friday for movies. For the interested reader, The statute definition expanded in December, about 4 weeks ago. The governor signed new legislation. Senate Bill 3355 was signed in December, adding language to the definition of temporary service agencies. So earlier I said it's agencies or businesses that provide or procure healthcare workers to healthcare entities. And that language expanded with the red language a couple weeks ago. So it's really any app or electronic platform that enables healthcare entities to engage individuals to perform healthcare services. For the interested reader, again, you can look up Senate Bill, S for Senate, S3355. You'll find it online. I will add it to our website in the coming weeks. It was just signed. And it just really clarifies the language, applies to what we call the garden variety temporary services agencies, which are maybe more brick and mortar. And it also applies to electronic platforms and apps and managed service plans and vendor management systems, that this statute really applies to all of the above. I have 1:42 local time. We're about 10 minutes early, which is a good thing. Here's our wonderful team, small team doing work, a lot of work, 600 quarterly reports, 600 registered agencies. A few of us were camera shy. If you don't have any questions, you can hop off. Thank you very much, everyone. We had over 200 attendees today. We provide this informational webinar every 90 days in case there are updates to the reporting instrument. We'll stay open for another 5 or 6 minutes. We're still getting questions. Here are our resources shown on the screen. The website is important to write down or copy and paste. We'll stay open for another 2 or 3 minutes. We still have a few more questions coming in. Thank you, everyone. Hi, everyone. I think we're going to close down now. Thank you for your participation.